My name is Seth Smith. I am a primary care sports medicine doctor at Florida Orthopedic Institute. The conditions that I treat are most musculoskeletal conditions. We think it's very important for patients to have access to great musculoskeletal care. We see patients from a very young age, even through the geriatric and master's athlete patient population. Yeah, so some of the common conditions that we treat are sprains and strains. We treat fractures, we treat overuse injuries. Our goal is to keep our patients as active as they possibly can be, regardless of what their conditions are. We want to sit down with our patients and put a plan together with them, and then we can get them back to being as active as they want to be. My patient philosophy is really, first off, I want to establish a relationship with a patient. I think we can work through their conditions together. I want to present them all of the possible options that are available, and our goal is to keep them as active as they want to be with the conditions that they have. And we want to do this together. We want this to be a team-based approach where we sit down together, we discuss different options, and we find the one that fits the best for them. And I always tell my patients that our goal really is to keep you as active as you want to be. That's the best medicine that I can give you. I think the most rewarding part of my job are the relationships that are created. I've had an opportunity now to do this for almost 15 years, and it's really a privilege to have the opportunity to develop relationships with patients, that they can call me or call our office and get in to see us very quickly, and we can sit down with them, we can put a plan together, and we can get them back to doing the things that they enjoy most in life. Florida Orthopedic Institute is created with great physicians, and I think that's the most important, is that they value their people. They're a physician-led group that really appreciates and understands the physician-patient relationship, and we think overall that's the most important part, because if we have a great relationship with our patients and if we value our people, I think we have the opportunity to really take great care of our patients.